What's good, y'all? How y'all doing? This is your girl Ruby Red, aka Liquidiamonz. Before I get into the story, I just want to put out a disclaimer. Please do not send any hate to Livslife, Gerard, Brandon, or anyone involved in this story. This video is simply meant to report on the news. On 11/5/2021, Liv posted a video, and she was saying that her test results are back and her son will be born with, or possibly be born with, a disability. She's not sure what it is. She's saying it looks like it is Down syndrome. And I just wanted to go through some facts with you before, we take this a little too far. I'm going to give you like an outline of the procedures and of genetic testing and at certain weeks and everything. I'm going to break it down real quick to you. Okay. I'm reading from an article. It says Grow by WebMD. I'm going to include it inside of here. Okay. It says, if you're pregnant or thinking of getting pregnant, genetic testing can give you a closer look into your health and your baby's health. Some tests can check babies for medical conditions while they're in the womb. Others check their DNA for some genetic diseases. Even before pregnancy, genetic carrier screenings can look at the mother's and father's genes to show the chances that their child would have a genetic disorder. Most of the tests are optional, but they can help you make health decisions and know what to expect when your baby comes. Learn more about each kind of genetic test so you can decide which, if any, are right for you. Before pregnancy, genetic carrier screening test. Okay, if you have a gene for a disorder but do not have the condition for yourself, you're called a carrier. Genetic carrier screening tells you if you and your partner have these genes, and if so, the chances you'll pass them on to your children. You can get the test either before or during pregnancy, but they're most useful beforehand. A doctor will take a sample of your blood or saliva for testing. The lab can look for genes for many types of disorders, but the more common ones are cystic fibrosis, Fragile X syndrome, sickle cell disease, Tay-Sachs disease, spinal muscular atrophy. People from ethnic groups may be more likely to be carriers for some condition, so ask your doctor if you're in a high-risk category. Common groups that may want carrier testing include non-Hispanic whites, cystic fibrosis, people of Eastern Europe, Jewish descent, Tay-Sachs disease, cystic fibrosis, and others, and those of African, Mediterranean, and Southeast Asian backgrounds, sickle cell disease. First trimester screening tests. Once you get pregnant, your doctor might suggest checking your baby's genes for the risk of a medical problem. Typical tests in the first stage of pregnancy are sequential screen. This test uses a mix of ultrasound and blood tests to look for the risk of Down syndrome, Trisomy 18, and spine and brain problems. You get it between 10 and 13 weeks of pregnancy. If the results are negative, you can choose to have more testing in your second trimester. Integrated screening is another mix of ultrasound and blood tests to look for the risk of Down syndrome, Trisomy 18, and spine and brain problems. You get it around 12 weeks, and the second part of it happens during your second trimester. It's slightly more accurate than a sequential screen, but it takes longer to get the results until after the second part of the test. Cell-free fetal DNA testing is when some of your baby's DNA winds up in your blood. That's what you can test, when some of your baby's DNA is in your blood. Getting cell-free fetal DNA testing. Okay, I'm explaining. After 10 weeks, your doctor takes a sample from you, and the lab tests the baby's DNA in it for signs of Down syndrome, Trisomy 18, Trisomy 13, problems with sex chromosomes. If any of your screening tests shows a risk of birth defect, your doctor will suggest a diagnostic test to confirm the results. The cell-free DNA test does not look for problems with the brain or spine. So if you get it, you can also get another blood test in your second trimester to detect those problems. Testing the father can also help. Some diseases can be inherited only if both parents carry the gene. Your doctor might rule out some problems such as Tay-Sachs, cystic fibrosis, and sickle cell anemia if the father tests negative, even if you test positive. The second trimester screening test in this part of your pregnancy, there are a few typical tests your doctor will offer. AFP test. This test screens for neural tube defects. It usually is done if the patient has already had the cell-free DNA test, which doesn't screen for these types of defects. Maternal serum quad screen. This blood test looks for proteins in your blood that can mean your baby has a higher risk of Down syndrome, trisomy 18, and spine or brain problems. Your doctor can do the test between 15 and 21 weeks. Integrated screening part 2. If you got the first part of this test in your first trimester, you'll have another blood test between 16 and 18 weeks. An ultrasound. Around week 20, a technician uses a machine to make images of your baby using sound waves. Your doctor uses these pictures to look for birth defects like cleft palate, heart problems, and kidney problems. Now I'm going to explain trisomy 18 to you real quick. Trisomy 18, also called Edwards syndrome, is a chromosomal condition associated with abnormalities in many parts of the body. Individuals with trisomy 18 often have slow growth before birth and a low birth weight. Affected individuals may have heart defects and abnormalities of other organs that develop before birth. Other features of trisomy 18 include a small, abnormally shaped head, small jaw and mouth, and clenched fists with overlapping fingers. Due to the presence of several life-threatening medical problems, many individuals with trisomy 18 die before birth or within their first month. 5 to 10% of children with this condition live past their first year, and these children often have severe intellectual disabilities. I'm also going to explain trisomy 13 since I explained that a lot. I said that word a lot. So trisomy 13, also called Pateau syndrome, is a chromosomal condition associated with severe intellectual disability and physical abnormalities. In many parts of the body, individuals with trisomy 13 often have heart defects, brain or spinal cord abnormalities, very small or poorly developed eyes, extra fingers or toes, an opening in the lip, which is called a cleft lip, with or without an opening in the roof of the mouth, which is called a cleft palate, and weak muscle tone. Due to the presence of several life-threatening medical problems, many infants with trisomy 13 die within their first days or weeks or life. Only 5% to 10% of children with this condition live past their first year. Diagnostic tests, which include an amniocentesis and chorionic villus sampling, which is abbreviated for CVS. Amniocentesis and CVS check babies before they are born for possible birth defects such as Down syndrome, trisomy 13, and trisomy 18. I'm going to give you a definition of the Down syndrome Down syndrome or Down's syndrome, plural, also known as trisomy 21, is a genetic disorder caused by the presence of all or part of third copy of chromosome 21. It is usually associated with physical growth delays, mild to moderate intellectual disability, and characteristic facial features. So let's go on and talk about this, okay? So trisomy 13, trisomy 18, problems with brain or spine growth like spine bifida. Only amniocentesis can spot these. Only that test, y'all. They can also find some genetic disorders. Both tests are over 99% accurate. Most women do not get these tests. They have a very small risk of causing a miscarriage. And most people who get screening tests that don't show any problems feel comfortable relying on those results alone. But the screening tests are not 100% accurate. So if your screening results show that your baby might have a birth defect, or if you want the most accurate test, your doctor may suggest CVS or amniocentesis. CVS tests a small part of your placenta in your uterus. Your doctor gets this tissue either with a needle through your stomach or within a thin tube into your cervix. Doctors do CVS early in pregnancy, between your 10th and 13th week. The test may cause cramps, bleeding, or infection for some women. During amniocentesis, your doctor puts a long, thin needle through your belly and into the sac that surrounds your baby to take out a small amount of fluid. A lab study shows the proteins and the cells in the fluids. The test is safest between 15 and 20 weeks. Sometimes amniocentesis can cause bleeding, cramping, or infection. If your doctor suggests one of these tests for you, it doesn't mean that there's definitely a problem with your baby. It means they want to make sure everything is okay or follow up on the results from another screening test you had. Talk with them about the pros and cons of these tests, as well as what the results might mean for you. Y'all, this is a real serious issue. I pray for Livslife and her family, and if she's going through this, prayers up and blessings up. No negativity coming from my way, but I'm gonna just throw an opinion in, and don't forget my disclaimer in the beginning of the video. Okay, she had issues with Gerard. Let's be real about what's going on. And she had to tell a judge that this is all an acting situation. YouTube is a job. This is for entertainment purposes only, y'all. We don't know what went on with her and Gerard for her to have to admit that to the judge. She went under oath, raised her right hand, said that YouTube is just a show. She's acting. We don't know how deep she's going with the acting. We don't have a clue. We not sure if she's acting at this point because she's bringing up serious medical conditions that can be possibly happening to her and her baby. Okay, we don't want this to happen to anyone. If it does, everything happens for a reason, and God can give you only what you can handle. And everything from my eyes, I tell you, good or bad, or whatever you want to put it, a challenge or whatever, it's a blessing. This is how I look at life. Y'all know me from already just being on my channel. But this, on the other hand, this probably has really happened to her, and she's just vlogging it out and in a slow process. Y'all see the side effects of having this type of child. It really doesn't live after 1 year old, okay, or a few months. So, like everyone is saying, she don't look pregnant. We don't know what has happened. They said this is a very big chance of a possible miscarriage if she gets tested, and also with the side effects of the development, if they detect that the baby is may have Down syndrome, you know, she might lose it early as well. So, you know, we don't know whether she's vlogging and letting us know what has happened to her. You know, Olivia likes to make a bag. So she might just want to tell her story of what has happened to her, and to receive that good old Christmas bag and Thanksgiving bag. You know, we all want to get our kids the very best for the holidays. You understand what I'm saying? But God forbid, you know, if this really just did happen to her, and she just has a very weird, odd way of, you know, presenting her story to her YouTube subscribers. You know what it is. You know what it is. So at the end of the day, like I said, prayers up to them. And we don't know, on the other hand, if she is really acting. She's probably taking it to you know, a storyline, just to make a story on her platform. Maybe she's writing scripts. Maybe this is something that did not happen. We don't know. All we want to know is the end result. And hopefully it's not a situation where she will be looked down on, y'all. That's all I got for y'all. But in this video, Brandon went live. Coming up next, Brandon went live last night. That's your boy Brandon right there. I just wanted to put him up on here. He's having dinner. He having a good time. Also, early afternoon, Gerard went live, and he was playing a song by Ari Lennox called, I think it's Unloyal. So I just wanted to show y'all, you know, these men went live yesterday, and I just wanted to show you, you know, what they're up to, and that's it, you know. But basically, you know, I just wanted to show some receipts on, you know, just genetic testing and some testing when the doctor, you know, would probably, you know, think that you need test after test if your child has any genetic issues, you know. So I just wanted to give y'all receipts, and you can go refer to the website. I went to webmd.com, baby pregnant genetic testing. Go check it out for yourself, read it out for yourself. You know, take your notes and do what you got to do. But till next time, I love y'all, man. You know, this is why I do this, and this is why it is what it is. And stay tuned, since tonight we doing that giveaway. I'm going to look at the poll and generate the names and video record that and give that to you before we go live tonight and talk our ish, our ladies night. You know how we do. We know how we do. Grown and sexy. That's right. Let's put on our crown and let's get down and talk about what's real, and, you know, that's it, the real deal. All right, y'all. Till next time. Love yourself. Love each other. Check out Gerard. Check out Brandon. Peace out.
That's a heartbeat? Is this a heartbeat?
That's him. You hear it from far away?
Yeah.
Your placenta is probably anterior. That's why we hear it so far away.
I guess I'm unloyal, baby. And you already know what I'm on. I guess I'm untrue. I guess I'm unloyal, baby. I know what you want. I guess I'm unloyal, baby. I guess I'm untrue. Oh. Guess I'm unloyal, baby. So tell me what you want.
Later.
Yes, I'm about to muscle, about to eat. Solo dolo. Erica, we ain't cool. Pretty lady. Where's the mashed potatoes at? Yes, I do. I got birthday coming up.
How you doing?
Okay, what's the name that I can put this under? Precious.
I'm gonna get out here and try to eat.